Welcome, everyone. This is Mayor Haggerty, and you're joining the Evanston Coronavirus Q&A. We have been doing these since April of 2020 as the pandemic really sunk in here in the Chicago and the Evanston area, and we continue to do them. I am pleased today that we have three preeminent doctors with us who are all working on the pandemic, who are our guests, as well as our public health director, Ike Ogbo, who has continued to do a good job leading us through the pandemic. So I'll have each of the doctors introduce themselves shortly to you. First, I just want to thank everyone in Evanston for the work that you all are doing by wearing face masks, socially distancing, exercising good hygiene, avoiding large groups of people. On the metrics, we continue to do really well here in Evanston, and that is because of the whole of community response and recovery approach that we have taken. It does not mean that people aren't suffering and sacrificing tremendously. That is happening, and there are great inequities with this pandemic. But we continue to do a good job here, and I'm so appreciative of everything that everyone in our community does. I want to stress it is so important that we remain vigilant. Everyone's watching the news, and I'm going to have Ike Ogbo speak in a minute about the current situation here in Evanston. But the numbers are rising. We're seeing the numbers rise nationally. We're seeing the numbers rise in Illinois, and we're not immune to that here in Evanston. And even though our positivity rate is a little above 2% right now, significantly less than what we're seeing at the state level or in the city of Chicago or even in Cook County, it is on the rise. That has increased a third in the last week. We have seen the number of cases, our 7-day moving average, almost double in the last week, from around 7 cases a week ago to about 12 is our new 7-day moving average. So we're not immune to that here in Evanston. And I want you to know a little bit more about what's going on here, and then we'll get into your questions. This is being broadcast live on Facebook. It's also on Channel 16, which is our public TV station here locally, and it will run throughout the week so we can continue to get the message out to everyone about what's going on here in the pandemic. So with that, I'd like to turn it over to Ike Ogbo. Ike, if you could just give a real brief sort of situation report for all of our viewers on where we're standing here in Evanston with the pandemic, that would be great.
Good day, everyone. Yes, as it stands in Evanston, we are looking at a positivity rate, as the mayor indicated, a little over 2%. This has actually increased from previous weeks where our positivity rate was in the neighborhood of 1+%. We're still in a good shape, but we are looking at increases in this positivity rate, which of course we want to address. And the way to address this positivity rate is to ensure that we continue to practice social distancing and all the public health directives. As it stands, our cases currently are 1,118 in Evanston. The active cases that we currently have is a little over 140, and the deaths that we've suffered here in Evanston is 74. Within the week, we had 1 death in the community. And where we are seeing the transmission rates, as we remember, in the beginning of the pandemic, we were seeing a high number of transmission rates in our long-term care facility. That has sort of shifted, where we're seeing our community, the community spread in Evanston, ranging from our teenagers to those 20 to 29. That's where we are seeing an increase of infection rates. But my advice to all of us would be for us to continue practicing these public health practices and recommendations and guidelines to get us through this pandemic. I think Evanston as a whole has done a good job. We are getting there. We're getting there, and I think we need to continue to do and apply these methods and practices that we've been applying for in the beginning, in the middle, and as we currently are going through this pandemic. So that would be pretty much a summary that I have, Mayor.
Thank you, Ike. I will, again, I just want to stress to people, while we're doing okay here in Evanston, numbers are on the rise. The infection rate, which is critical, which means how many people does one person with COVID-19 infect? We have seen that jump from around 1.0, and you really want that at 1.0 or less.
Yeah.
You've seen that jump up now, Ike, to what, 1.25 or so?
Yeah, about 1.2. Mm-hmm.
So 1.2%. And so when we talked earlier in the spring about slowing the spread, it was because of the exponential growth potential of this virus. And that's all with that infection rate. So we need to keep doing our part, all of us. So let's get to the doctors that we have on here. Now, first, I want to go to Dr. David Hines, who is with Metro Infectious Disease Consultants, and they are on staff with Amita St. Francis. And Dr. Hines, I want to go to you first because you work with an organization that has really probably at least a United States, if not global, perspective of what's happening here, and would love just some initial thoughts of yours about what's happening out there and what we ought to be thinking about here in Evanston. And then I'm going to go to Dr. Singh, who's working on the pandemic with North Shore University Health System.
Sure. Thank you. And I'm happy to be here. And as the mayor said, I'm in a busy group that goes to 7 states. We have very active practices in Kansas City and Phoenix and Huntsville, Alabama, and Atlanta, Georgia. And we have weekly calls with the whole group. All 100 doctors are on this weekly phone call as we share our experiences. And we're also involved in some research with various cocktails of medicine for COVID-19. And I came to St. Francis at the beginning of the year, and with that came COVID-19. And when it was really busy in April and May, we would have 20 or 30 patients filling our ICUs and very sick patients at the beginning of the year. And then it kind of slowed down so that in May, June, July, we dropped to maybe half a dozen cases or so. But unlike influenza, which goes away with the warm weather, this viral infection has persisted and it hasn't gone away. And that's why keeping social distance and wearing masks are really important in keeping the spread down. We're seeing a slight increase in the cases at St. Francis. And we do get very sick patients who end up getting intubated in the ICU. It does seem, though, that less people are dying of COVID-19 than before. When it first came on in the spring, it was horrible. We weren't sure of how to treat them. Now patients are getting more stable cocktails that include steroids and anticoagulants, and maybe some plasma, maybe some very expensive drugs like tocilizumab and remdesivir. So we have opportunities to keep them from dying. But the message is we're still seeing it. It's not showing any signs of going away soon. And we hope that we'll have a vaccine or monoclonal antibodies to help treat people in the future.
Thank you, Doctor. Dr. Singh, can you give us a perspective from North Shore University Health System? Lots of our residents obviously go there. They go to Amita St. Francis. And what are you seeing on the ground in terms of hospital admissions and other insights on this disease?
Thanks, Mayor, and thanks, Ike, as well, for inviting me. It's a real pleasure to be here. I will echo what Dr. Hines has said, and that we're seeing cases go up dramatically across the state and certainly across Cook County as well. At North Shore, we have a similar experience as Dr. Hines indicated. We saw our first peak of cases around April and May, we had our first patient here staggering. And we slowly dropped away in May, and we similarly had a very low number of patients for what we've seen in the last couple. So we probably had tripled the number of patients we had in the hospital compared to a couple of weeks earlier. So at North Shore alone, we had almost 50 patients admitted to the hospital with COVID infection. Now, I will tell you that if you look at the breakdown of ages across the state of Illinois, where we're seeing the highest number of cases right now are truly, as the mayor indicated, amongst the young, which is the 20 to 30-year-old category. But where we are also seeing pretty steep increases in cases are now in the older population. And so what I think is going on is that this truly did start with the younger individuals. And unfortunately, we don't live in a bubble. So these young individuals go home and have dinner with mom and dad or go visit grandma and grandpa, and unfortunately transmit the virus to them. Because what's very interesting is when we talk to the majority of these patients who are in the hospital, most of them can relate a household transmission event either from a child or a grandchild. And so, again, we have to be extremely vigilant because the hospitalization rates are clearly going up across the state and at North Shore as well.
Thank you, Doctor. And I just want to reinforce that point to all the viewers, particularly those of us, including myself, who have teenagers or have young adults in their 20. Well, the likelihood of them being severely harmed by this disease is low. There's a great likelihood that they transfer that to their parents, or they transfer that to their grandparents, who may be at much greater risk should they get this virus. So please, wearing masks all the time, even if you think I don't need to wear a mask, makes a huge difference. We know that, the doctors know that. Let's get to the questions. So if you have questions during this, you can put them up on Facebook, and Patrick Degnan, who helps coordinate all of these, will help feed those to me. We'll try to get those questions answered. But we already have some that have come in, and so I'm going to ask our third doctor, Dr. Siglin, who is with Amita Health, if you would take this one. The question came in: is it advisable to get an annual checkup or other routine medical exam at this time? One of the concerns that I'm seeing in the papers that our public health director and I are talking about are people not taking care of themselves and getting the types of checkups they ought to be, in the screenings they ought to be getting, and a lot of other diseases, cancers, and so forth going undetected. So I know people have concerns about coming into medical establishments during this time. Could you talk about that, Dr. Siglin?
I'd be happy to. I think you're raising a really important point. A lot of patients are not getting the care they need: the mammograms, the colonoscopy, the physicals, the follow-up on their illness. We're seeing, patients having heart attacks because they're not coming in and getting the care, or strokes. I think it's very important that patients feel comfortable to come in and get the care they need. The doctor's offices, the hospitals are very protected. We've changed our processes and our guidelines, and we don't have waiting rooms packed with patients. We have everyone wearing masks, including the patient as well as the doctor. Practitioners, when they're doing examinations of patients, have masks on, face shields, gloves. Everyone is hand hygiene. Rooms are sprayed down. So it's very safe. We haven't seen transmission of this virus in that kind of setting. So everyone should feel comfortable to come in and get the examinations that they need. I think that's one of the risks that we have right now, is patients failing to take care of themselves.
Thank you. So it is safe to go to your doctor. There are procedures and practices that they are implementing, and we're not seeing transfers of the virus in these medical settings because of the protocols that are being taken. Catherine had emailed, and maybe you could just emphasize this point, Dr. Siglin. She says, are doctors and patients required to wear masks during medical exams and procedures, or are there exceptions to that?
So the doctors and patients should be wearing masks, yes. In addition to that, when procedures are being done, doctors are not only wearing an N95 mask, but they're wearing a surgical mask and they're covering it with a face shield. So they're very well protected. The patients are wearing a mask. The only time that the patient is not wearing a mask is if they need an evaluation of an area that is covered by the mask. So it has to be removed to look at the nose, the mouth, the face, something of that nature. But otherwise, masks are worn by the patients as well. And under those circumstances, transmission of a virus is almost non-existent. It's very minimal.
Mm. Ike, I don't know if you saw, but to this point about people not, taking care of themselves the way they would during a non-pandemic time, there was a report this week out, I saw it printed in the New York Times, about the number of fatalities this year. And they know how many fatalities are related to this. Did you see that? And can you just talk to folks about that? Because I think it drives home this point.
Right. I don't think I saw that article, Amaya, but in regards to the number of deaths, as one of the doctors alluded to, at the beginning of the pandemic, there were numerous fatalities, but we've actually started to see a decrease in fatalities in the state. Even with Evanston as well, as you know, Mayor, our most recent deaths just happened within the week. Prior to that, we didn't have any deaths. But at the height of the pandemic, we suffered quite a number of deaths. Our death rate, fatality rate in Evanston is just a little bit below 6%. That is not something that we are happy about because, of course, we've had people perish due to this virus. But I think what has happened is we have implemented infectious disease control. At the beginning of the pandemic, everyone was scrambling and trying to understand what this new virus is. This is a novel virus. How do we protect ourselves against this virus? And I feel that our healthcare workers in our long-term care facilities and in other areas, that they've actually worked really well in their infectious disease control and measures and the strategies that we've taken to limit the spread of the disease and, of course, to prevent deaths at these facilities.
Right. So the good news is, right, we're seeing less deaths right now, I suppose, as a fatality rate to this virus. But what we are seeing, and epidemiologists and other experts that are studying this are seeing that the death rate year over year is considerably higher than just the COVID-19 related deaths. Now, I'm sure there's some COVID-19 related deaths we haven't accounted for that aren't in the number per se, but there's even additional deaths. And those additional deaths are coming about because of what Dr. Siglin and others have talked about, where people aren't getting colonoscopies, breast cancer exams and all of that. And we're not catching it early enough to save lives. So again, please take care of yourself. Please go to the doctor. The hospitals and the doctor's offices are taking this very seriously. There are significant protocols on them, not only by their own institutions, but by the Illinois Department of Health and other institutions. Dr. Singh, Samuel asked us, I recently had my annual flu vaccine. How safe should I feel against COVID-19? So I think there's two things there. Let's talk about the importance of the flu vaccine, and does that in any way protect you against COVID-19?
Yeah, Samuel, thank you. That's a good question. So let's just pivot towards the flu vaccine first of all. So the influenza vaccine really only protects you against infection due to the influenza virus. And we all know that the weather is cooling down and we're approaching winter, and generally influenza is a seasonal virus, so we tend to see its peak effect during the winter season, and then it tends to disappear as summer approaches. Now, this is where influenza is different from COVID. The COVID virus, unfortunately, doesn't have a seasonality, and it belongs to a family of viruses called coronaviruses, which are quite different viruses to the influenza virus. So the influenza vaccine, unfortunately, will not protect you from the coronavirus, but the benefit of having taken the vaccine, and I applaud you for having done that, is that it will protect you from influenza. And probably the worst thing that can happen to us here in Evanston, the state of Illinois, and the country in general, is to have two viruses co-circulating at the same time, because it's difficult enough when we're dealing with the COVID pandemic. It'll be doubly difficult if we had to do this in the midst of an influenza outbreak as well. So I do strongly encourage everybody that's listening in to go out, get the influenza vaccine, encourage your family members and your friends and your co-workers to get vaccinated as well, because it is a safe vaccine and it is a vaccine that works, and it will protect you against the influenza virus.
Thank you, doctor. I get a flu shot every single year. And this year, it's more important than ever that we all get flu shots, because you're not only preventing yourself from catching the flu, you really are saving lives, because you're freeing up capacity in our hospital systems so that those that have COVID-19 can get the care and the treatment that they need. So please keep that in mind. And Ike, in terms of the flu vaccine here in Evanston, where could people get that vaccine?
Well, they can get it from CVS, Walgreens. They're administering the vaccine. They can go through their medical provider. There is also a website that they can go called vaccinefinder.org that will provide information of nearby pharmacies or medical providers where they can get the vaccine.
Thank you. So vaccinefinder.org. And my understanding is, again, because of the pandemic, with CVS and Walgreens, is it that you need to go online and make an appointment? So you actually have a time when you come in. So again, they're not lining up, 3 dozen people waiting for the shot, is my understanding. So please go out there and get your flu shot. Just a little music for everybody. All right, let's go to Dr. Hines on this one. Rosalie asked, I received a positive COVID-19 test from CVS on October 5th. And I have been isolating completely ever since, but have very minimal symptoms. Do you think it would be possible for me to have not built up enough antibodies to prevent reinfection?
Yeah, that's an excellent question. And typically after a viral infection, within 10 days, you are making antibodies to not be infectious anymore. But I'll say that in quotes, it's probably more like 2 weeks that you can trust that your own immune system has made enough antibodies to protect you. But again, that's without symptoms. So you really have to be without fever or cough for a period of 10 days to 2 weeks before you can say you're not infectious.
Okay. All right. Thank you, doctor. Dr. Dr. Siglin, I'll ask this question. Sally wrote us and asked, as a resident of Southeast Evanston, can I go to Evanston Hospital or St. Francis Hospital if COVID-19 symptoms require hospitalization? If not, what are my options? And so I think people continue to have questions about, where they could go and get a test. And then if they were really ill with it and had to be hospitalized, where they could go for that hospitalization.
So as far as St. Francis goes, yes, we have been taking care of patients with COVID. So if you have mild symptoms, you can recuperate at home. If you are feeling ill, you really should come into the hospital emergency room, get examined, and get admitted to the hospital if necessary. And, we have all the protection, negative pressure rooms, et cetera, to safely take care of patients. What I would advise is if somebody feels they may have COVID and they're coming to the emergency room, to call ahead and let the team know, because we want to make sure that we protect them. We protect our care givers, our associates, and any other patients. So we want to provide them with the proper protective equipment and masks before they even walk in. So we prefer a call ahead so that we know that you're coming, and we do take care of patients in the hospital with COVID. So yes, we're available. North Shore has, and Dr. Singh can speak to this, I believe, has been using Glenbrook mostly for their COVID patients. Maybe he can speak to Evanston Hospital.
Thank you, Dr. Siglin. Dr. Singh, yeah, I would. I think it would be great for you to talk about how you and how North Shore University Health System, communicates with patients that test positive. What that threshold is? Do they just go to the emergency room, or should they be talking to their primary doctor, and all of that?
Thank you. As you know, North Shore University Health System is actually an organization made up of 4 separate hospitals. There's Highland Park up north, Glenbrook Hospital on the west side, Skokie Hospital, and obviously Evanston Hospital. Now, all of these hospitals' emergency rooms will receive any patient who needs to be evaluated for COVID symptoms. In addition, if you need to get tests for COVID done because you have symptoms, but you're not sick enough to warrant a trip to the emergency room, you can go to northshoreconnect.org and sign up to get a test done, and you'll be directed to one of our immediate care facilities or our drive-through testing facility at Old Orchard for the test. In terms of housing of patients who may require hospitalization for COVID, Dr. Siglin is correct. North Shore basically has decided to continue to get the kind of care that they require for their today problems. So, for example, if you need to be hospitalized because you have congestive heart failure, now, we want you to come to the hospital. We want you to be treated. And so we designated a number of our hospitals to take care of those problems. If you, for example, have an orthopedic issue, you have bad arthritis in your knee or your hip, and you need to get that fixed, then we would, of course, direct you to Skokie Hospital, which is our new orthopedic and back institute. If you test positive for COVID and need to be hospitalized, then we will direct you, we will transport you over to Glenbrook Hospital, where we have specialized rooms and COVID teams that have been trained on managing and treating patients with COVID infection. So these sorts of distribution of our resources really allows us to optimize care of patients for both their COVID and non-COVID conditions, so that we can, so to speak, operate as normally as possible and allow patients to get their usual care, which a lot of them have been sort of foregoing because of their concern about the pandemic, and they don't want to go into a hospital.
Thank you, Doctor. Thinking about some screenings I need to go into the hospital and have done. So after this coronavirus Q&A, I'm going to call my doctor and make an appointment. Ike, I had a question here. In addition to following public health directives, I think lots of people know about, washing your hands, keeping your distance, wearing a mask. What else should residents do to stay healthy during this time?
Absolutely. Thank you, Mayor. That's a very good question. And that's what we're doing here, given the messaging that we are sending to the public regarding checkups, regarding screening, regarding vaccinations, because these will help protect you during this pandemic. And also another aspect that we typically do not talk about, or that has come to the front seat, so to speak, is mental health. Mental health is very important during this period. This pandemic is stressful as it is, and a lot of people are undergoing stress. So during this pandemic, as you are taking care of your medical needs, it is also important for you to take care of your mental needs. Take a break, make sure that you are exercising, read a book, make sure that you are in touch with loved ones. I think if you apply these practices in your life, that will help with your mental health. Are there some organizations that you can tap into, some individuals who can help you through this pandemic? I think that's very, very important. And also having access to mental health is also very important. And for those who are seeking any type of mental health accessibility or agencies, it is listed on our website. If they can go to our website, we do have a number of agencies that can help people go through mental health difficulties during this period. But if you apply these practices, I think you will be okay through this pandemic. It's just not the medical aspect of it, but we also have to look at the mental health aspect as well.
I'm so glad you brought that up, Ike. I mean, we know that mental health issues were on the rise way before the pandemic. We saw that in all the data, and we're seeing it in the data that more and more people are struggling just with their own mental health, which has a direct correlation to your physical health because of the pandemic. So I appreciate you saying that. I know there's a lot of resources out there for people. Another question, and it sort of relates to health, slightly off topic, but it just came in from someone that's watching this, and it's from Heather, and she asked, where can residents experiencing homelessness go during the day as the weather gets colder? Is there a plan?
Yes, so we have pre-pandemic, we had our city buildings that were open to individuals who want to warm up to receive some warmth. There is, of course, a plan in place to designate one of our facilities where homeless individuals can go and get warm. During the hot season, we designated a facility for homeless individuals or people who want to cool off. And we were able to use one of our facilities for that. And the plan is to continue to use this particular facility or a number of other open city facilities for homeless individuals who are seeking to get some type of warmth.
So Heather, our emergency operations center for the city remains active due to the pandemic. We meet every Wednesday. I'm going to ask that this topic be placed on that as the colder weather is coming, because we have always done stuff. Interfaith Action has been very involved in this. It's done excellent work. But because of the pandemic and the protocols that need to be followed, we need to make sure that we've learned from last year and have a better plan this year how to take care of our homeless. So, Ike, if we can just make sure that's on our agenda for next Wednesday. Ike, I had a question from Sally here, who talked about there's a testing event run by the state coming up at Evanston Township High School, October 26th and 27th. If you could just tell a little about that. And her question was, is there any risk of contagion from attending such an event?
So, as you know, Mayor, we've had a number of these events, and it's very important during this pandemic that we get testing. The way that we have set up our community testing event is setting it up in the best possible way where individuals are not exposed to any type of contagion or COVID-19. We have set it up where there are two options, a drive-in option and a walk-through option. If you are selecting, if you're going to be a participant through the walk-through option, the advice is for you, of course, to queue up, maintain social distancing, and wear your mask when social distance is impractical. And the collection of the sample doesn't take that much time. It takes less than a minute for the healthcare workers to take the sample. So, in essence, your only interaction will be with the healthcare worker taking your sample. And if it applies to those who are driving through, the cars pull up, the healthcare worker comes, takes your sample, and that's it. So it takes less than a minute. So we've designed it in a way where there is less interaction with people, and we are not forming any large crowds at these areas. And we have been very successful in conducting this event, and we're really looking forward to our event next week.
Thank you. So the key to us, managing and containing this virus until we get a vaccine is about preventative measures that we each need to be taking, and that's the wearing the mask, washing the hands, socially distancing. It's testing and making sure we get people tested, and it's contact tracing. Once somebody has been tested positive, we have to do contact tracing. And here in Evanston, I'm really proud that under Ike's leadership, we have done contact tracing from day one. And we have a great group of people that continue to do that. Robert had a question, and it relates to what we're learning from contact tracing. And I'm going to ask you, Ike, but if the doctors want to chime in with anything here too, I'd welcome that. He asked a question, can you provide any information on the source of the recent spikes in Evanston? Where's it coming from? Just like that prior question, she's concerned about, geez, if I go to this testing event and there's 100 people there, am I more likely to get the disease there? And through contact tracing, we can get a sense of where there may be spread occurring. So Robert's just asking, have we done that kind of analysis, and are we able to identify, and if so, then better mitigate what's occurring?
Yeah. So as we know, COVID-19 is widespread. We have it in Evanston, and what we've experienced is our new cases are due to community spread. Although we've had some cases in our long-term care facilities and other establishments or facilities, but it continues to be in the community. And that's why it's very imperative that we follow public health directives about wearing your mask, social distancing, hand hygiene. When you cough, make sure that you cough into your hands and nose. So all these directives are very important during this period. When it comes to transmission due to travel, we're not seeing too many cases in that regard. We've done some analysis to see where the uptick of our cases have come from, and it's not really attributed to travel. It's a very nominal number of cases due to travel, but we continue to see it within the community, whether it is people who are at restaurants, at our bars, we see it there, or just people in the community. And that's why it's very essential, like I mentioned, to continue to practice these recommendations in your everyday life.
Thank you, Ike. In terms of the contact tracing, Sue has asked, is it safe that, quote, private pre-K schools are open in Evanston, And I think that would apply to other schools if we have religious schools that are open either hybrid or full-time. Our public schools still, for the most part, remain e-learning only. ETHS is e-learning only right now. District 65 has taken some students back, a very, smaller number, I think at 3 different schools. So I think there's lots of questions that people have about, is it safe to be in that school environment or in that childcare environment? And I know the other question, they're not asking it right here, is, hey, when are kids going to get back to District 65 and into ETHS and other schools? And I continue to work closely with our superintendents here in town. They're part of the Mayor's Pandemic Task Force. And I know they are looking at the larger positivity rate for the entire region, which, again, is moving in the wrong direction right now and going up. So we can talk more about that at a different coronavirus Q&A.
Absolutely. Mayor, so that's a very important question. And planning is very important to safely reopen schools. And as we're aware, we've had a number of schools that have reopened, Northwestern being one. Some of our private schools, of course, have reopened. And we've been in constant communication with them regarding protocols and strategies and measures to continue to operate safely. So as it pertains to classrooms, it is very important, the layout of the classroom, to ensure that the seats, the table, and the furniture where we have our kids, students, situated or 6 feet apart. And not only that, to make sure that we have an ample supply of face coverings if the students come to school without any. And of course, we are strongly encouraging everyone, of course, to have their face coverings. So in situations where a 6 feet distance cannot be met, we are requiring individuals, of course, to wear their face coverings. And not only that, cleaning and disinfecting is also very, very important during this pandemic, to ensure that we are cleaning and disinfecting furniture and high contact surfaces. And not only that, even though we are allowing students to return to school, the room has to be set up in a way where it allows a certain capacity. The recommendation at this point is recommending 50% of the capacity that a room will normally fit. So as we are planning, we'll have to take a look at the design and the layout of the room to make sure that we make these concessions, make sure that we make these things so that we can operate safely in those spaces. So I think that is the basis of it, planning and making sure that that's executed timely and properly.
Thank you, Ike. Dr. Hines, Rosalie, who asked a question earlier, just had a follow-up. She said, I have read that a high temperature, fever, is what kills the virus. Is this true? I have had 2 past COVID tests, but I still have minor symptoms, including a lingering cough. You're muted, doctor.
Unmute, how's that?
There you are.
Okay, sorry. I lost connection with my computer, so now I'm calling you on the phone. Anyway, my concepts of fever have changed since I was in training, where we would try to cool patients down that had a high fever. But really, the fever is the body's way of trying to kill whatever organism is causing problems. Now, in children, high fevers are dangerous because of the association with seizures. But in an adult, a high fever is the way that the body can deal with an infection. So I'm not particularly afraid of high fevers, and I think it's a good immune response to whatever is causing it. The patients that we've seen with COVID don't have that high of a fever. I mean, they can go up to 101, 102, but to get higher than that, in my experience, has been unusual. So I don't think fever should make you think one way or the other about whether you have COVID or not. And I think it's the body's way of responding to it. If you have a high fever, then you should go to the emergency room to be evaluated to check your oxygen levels to see if you need supplemental oxygen in the hospital.
Thank you for that, Doctor. And then, Dr. Singh, to add to that, I don't believe Rosalie has a fever, but is wondering if that's why she still has symptoms, meaning if she had that high fever and everything else, it could have killed off the virus. I don't know if there's anything you want to add to Dr. Hines' thoughts on this.
I do apologize. I lost the first part of the question because the Zoom reception cut out here. But as I understand it, this individual's fevers have resolved, but they've not completely recovered, or they don't completely feel well. Is that the question?
I guess that, as I understand it, it looked like she was saying she's read that the high fevers can sort of kill the virus. Dr. Hines spoke about that. She doesn't have a fever, but still has these other lingering symptoms, and
okay. Sure.
You know, maybe thinking, oh man, if I had the high fever, then it would take care of these other symptoms and I'd be done with it. I don't know. I'm not a doctor.
Yeah. So so as Dr. Hines probably answered earlier, everyone seems to have a different constellation of symptoms. And that's because, and that's what's most troubling about this virus and trying to get a grip to who's infected and who's not. Because the symptoms can range from a very mild illness to a very severe illness. And within that range, people have a different constellation of symptoms. So adults tend to complain more of body aches and headaches and just general fatigue and malaise with cough. If that progresses to shortness of breath, of course, we ask them to come in immediately to be evaluated. Children, on the other hand, seem to be more likely to complain of a sore throat. And adolescents tend to have more headaches, body aches, also some sore throat. And within the mix of all of these, patients report variable temperature spikes. Some do not recall having fevers, and some recall fevers with terrible chills associated with it. And in some of these individuals, I think the reason for that is when their headaches and their body aches start, they start taking the Tylenol and the ibuprofen, which in turn masks the fever. And so when you ask them directly, do you remember having a fever? They say no, but really the fever's been masked by the treatments that they've been taking for their general malaise and their body aches. So it sounds like in this case, fever is not a prominent part of her symptomology of COVID infection, but rather she's having other symptoms, which again, as I said, are not uncommon. Some people have runny noses, sore throat, loss of smell and taste is a very unusual but prominent feature that should make you think of COVID. And those symptoms can actually linger for longer. Some have a general malaise. There's been a syndrome of brain fog described as well, where people feel that their memory and their mental cognition is not quite as sharp as it used to be.
Thank you, Doctor. We have completed the questions that have come in today for the doctors that are on this panel. So they have people to get healthy and lives to save. So I am going to just offer a big thanks to Dr. Michael Siglin with Amita St. Francis. Thank you for being with us today. To Dr. Kamal Singh at North Shore University Health Center. Thank you for being with us, Doctor. And to Dr. David Hines, the Metro Infectious Disease Consultants, which is on staff at Amita St. Francis. Thank you so much for being here, sharing your expertise. I'm going to let you all get back to work. Ike, I'm going to keep you for a 5-minute rapid fire questions that we've got from a few more people, okay?
Thank you very much, Mayor.
Thank you, doctors.
Thank you. It's been a pleasure.
Be well.
Bye-bye now.
Thank you for the opportunity.
Thank you.
All right, Ike, we're down to the last five minutes. So this is rapid fire, quick questions and quick Quick responses. Mary Beth asked, are the number of active COVID-19 cases on Northwestern's campus included in the city of Evanston's number of active cases that are shown on our on our website?
Yes, it includes students and staff who live in Evanston and attend school at Northwestern.
Okay. Does Evanston still have a mask mandate? If so, what are the current rules surrounding wearing a mask outside?
Yes, we have a mask requirement that requires individuals to wear face coverings when it's impractical to meet social distance of 6 feet between each other. And this actually applies to outdoors and indoors.
Okay. Can you talk real briefly about transmission rates outdoors? Because I know you get a lot of emails. I get a lot of emails from people that say, hey, I would really like to see the city mandate masks outdoors. And that is not part of the governor's order. It's not the recommendation of IDPH. So can you just talk to people about transmission rates outdoors? Because my understanding is it's a lot lower, and I just want to put some people at ease on this issue.
The requirement is for individuals to wear face coverings when they're not able to meet the social distance of 6 feet. We have to keep in mind that the transmission of this virus is mainly through respiratory droplets when someone coughs, sneezes, or talks. So when you do not meet the social distance of 6 feet, you're required to wear a face covering. Outdoors, the transmission is less. Indoors, it is higher because people are more in close proximity with each other because of the indoor environment. Outdoors, the transmission is quite lesser than indoors. And we've gotten a number of requests or emails saying, why don't we mandate an outdoor mask wearing? But that's not following public health protocols from the CDC or from the state. You're required to wear a mask outside when you're not able to meet that 6 feet social distance. And of course, indoors as well, when you're not able to meet that social distance of 6 feet.
And I would say all in all, my perception, and I'm around town quite a bit, is that I see a lot of people wearing masks outdoors, particularly when I'm downtown and my company's office is downtown. And I always wear mine outside when I walk around downtown. And I see most other people doing it. When you go indoors in restaurants, all of that, you have to be wearing a mask. Into our stores. That's more important than ever, given that we're going into cold season, and we know the transmission rate is much greater indoors than outdoors, and that's why there's a lot of worry among public health experts and mayors and others in this country about the rising number of cases we may see during the cold weather. We got two more questions. One from Jim: are there any official or unofficial guidelines for condo apartment buildings that have indoor pools? People are discussing whether or not the water is safe instead of focusing on the issue of exercising in an enclosed area without masks. Any insight into that? And I think this is an interesting question because, again, we do want people still to be healthy during this time, and exercise is an important part of being healthy.
Absolutely. There's no evidence that suggests that COVID can be contracted through water or swimming activities. But there are guidelines that you can follow to make sure that you are safe when you participate in such activities, which of course is as you are lounging around the pool area to practice social distancing, eliminate large crowds, wear masks as you're lounging around the pool facility. But it is not recommended that you wear masks inside of the water because of breathing problems. Also, around the pool area, look at the layout of the pool to have furniture distanced from one furniture to the other so that we can maintain that social distance. Also, if you are sick, stay home. If you're exhibiting any symptoms of COVID, stay home. So these are the recommendations in regards to pool activities or any exercise that one is doing during this period to keep everyone safe.
Okay, thank you. Last question from Helene. If I quarantine for 18 days, contactless grocery, no contact with others, even with masks, and take a COVID-19 test after 14 days of quarantine, is it safe to share Thanksgiving with my parents who are in their 80s? I think this is a question that a lot of people have.
So the reason why one will be quarantined is if that individual is identified as a close contact to someone who got infected with COVID-19, or that individual has traveled from a high incidence area, although we're not recommending 14-day quarantine in Evanston, but there's some areas in which they recommend 14-day quarantine after returning from a high incidence area. So these reasons will be why someone will quarantine. And the reason for the 14 days, Mayor, is to ensure that you've passed the incubation period of the virus. The incubation period of the virus is 14 days. And if you do not develop any symptoms within that period, you're pretty much free to interact with others. But as you are doing so, as you indicated, their parents are in their 80s or older, they're the most vulnerable to this virus. When you're doing so, the recommendation, the advice is for you to wear your mask, practice social distancing, practice hand hygiene, so that your elderly parents or anyone, period, do not contract any type of virus. So that's the recommendation given that. So if the individual tests within that period and test negative, that's all well and good. But if this individual, even in the course of them quarantining, test positive, then that individual, of course, will have to be isolated for 10 days. 10 days is when the individual is the most infectious. And after 10 days, if the symptoms improve, if there are no symptoms even, but you're required for that 10-day period to be isolated.
But presumably, Helene's plan here of quarantining herself, not having contact with anybody, testing herself, afterwards, if she tests, negative, presumably she doesn't have, the COVID-19. But your suggestion would be, if you go visit your parents, Helene, to still practice social distancing and even wear a mask outside of eating your Thanksgiving dinner in the house, just to be extra cautious. Is that fair?
Absolutely.
All right.
Especially if you're visiting your parents who are well in age, who are advanced in age, who are 65 years or older, make sure that you're wearing your mask when you visit them. And this applies to everyone. Whenever you cannot maintain a 6 feet distance between each other, make sure that you wear your mask.
We all love our parents, and it's hard to miss a whole holiday, particularly as your parents are older. And like Helene, my parents are increasing in age, and I'm not going to get to see them at Thanksgiving, but certainly would love to, and would have that same question that Helene has today. So Ike Ogbo, thank you so much for spending an hour with us today. Thank you for the leadership that so many people feel blessed in this community to have under your leadership of our health department. Thank you to everybody that has watched today, and let's keep being vigilant. Let's recognize that we're not immune, that infection rates are going up across the country, in our state, and even here in Evanston, and we all need to continue to be vigilant. We know what we need to do. And last message, if you have someone like I do that's a teenager, or you have young adults in your family, please sit down and stress to them, it's not about your concern, although we do all have a concern. I don't want my child to get COVID-19. It is about the transfer of infections from young people, and that's where we're seeing a slight spike, to others who have underlying health conditions, or older folks who are more at risk of having severe complications from COVID-19. So let's all keep doing our part and saving lives in our community. Goodbye, everyone. We'll see you again.
Thank you.